We're here at HIMSS 2018 to talk about how to make health data useful to the individuals. We have Mike O'Neill, Chief Executive Officer of MedicaSoft, and also Randy Farmer, Chief Operating Officer of the Delaware Health Information Network, or DHIN, or as most people call it, DHIN. We're excited to have you all here. Welcome.
Glad to be here.
Glad to be here.
So, Randy, let's start off with you. Tell us a little bit about DHIN and why you chose to offer a personal health record with MedicaSoft.
Well, sure. Actually, it's real exciting. We've been thrilled to work with the folks at MedicaSoft. We were the first statewide health information exchange to launch in the nation. Statewide health information exchange to launch back in 2007. We've got a lot of data, and part of our mission is to make it useful, not just for clinicians, but also for patients. And making data available to patients is going to engage them more with their healthcare, which is a key part to bringing down the cost of healthcare. So it just made a lot of sense that we get into the business of not just providing secure, accessible ways for clinicians to access the data, but also for the patients that they treat.
Awesome. So tell us, what are the opportunities that really come out of giving patients access to this clinical data?
Sure. Well, it puts patients in control of their health and wellness, and it does that in a way that makes sense for them. So some people may be healthy and want to stay that way. You may have people who have a chronic condition. What they want to do with the data may be different, but it all starts with being able to access all of their information, whether it's from their doctor or from a lab, or their own data from their own devices, and then put it in a format in a way that they can actually understand it, use it for themselves, and share it with people that they trust who are involved in their care.
I mean, that's the thing that's so important, I think, Mike, is that this provides a platform for folks to securely share their information with people that advocate for their care. And it's sorely needed, for sure.
Well, and one of the challenges, I think, for every HIE out there is how can they be sustainable? Mm-hmm. Is this access one of those ways that's going to make an HIE a sustainable solution?
Absolutely. That is another point of pride of ours. We've been self-sustainable since 2012. We provide products and services and get paid for those products and services, and delivering value, to hospitals, labs, radiology firms, insurance companies, to the state. So everything we do has to do with perpetuating and solidifying that status as being self-sustainable. So this is another means by which that, one, as you make something more relevant, you're only going to increase the ability for you to be able to derive value out of that, and to be able to go ahead and add to the ways that you can continue to be financially sustainable. We're a nonprofit organization, so one of the neat things about how we do things is that we look at how this is really going to impact a certain segment of the healthcare ecosystem. And we're not looking to satisfy shareholders or stock analysts on a quarterly basis. Fortunately, we don't have that burden. It's about doing the right thing for patients, it's about doing the right thing for the clinicians, and at the same time delivering something that they sorely need. We think that this could help in the fraud, waste, and abuse segment. We think this could help also with clinical research. And those are going to be areas which are going to, depending upon the materiality of the value we deliver, we're going to be able to be compensated for, providing these products and services.
That's great. And do your provider members access this data? Because there's been a lot of discussion. A lot of patients don't care, right?
Sure. Well, you don't care until you care, right? Uh-huh. Until you have something happen, and we all have something happen. Uh-huh. We all have loved ones in our lives that are dealing with clinical conditions. I've got an 84-year-old mother, and I want to stay close and help her and be a care advocate for her, just like a lot of my colleagues that are similar stage of life as I am. Sure. And this is another channel to help make that information available. We launched back in 2007. We've got over 28 different data centers. We've got alerts from hospitals in 5 other states and the District of Columbia on Delaware patients that traverse those ecosystems. So with all that information coming in, with millions and millions of records, we got to make this valuable or useful or accessible in a secure way to patients and to care providers. And the PHR really provides a great tool to make that happen.
Great.
Sure. One of the things that I think DHIN is in a really unique position to help address is, as the way care is delivered and paid for evolves, both providers and patients realize they need more data than they each have individually. So A hospital needs the data on the patient care no matter where it was delivered.
Yep.
As they get aggregated clinical data, they can really get a sense of outcomes and care quality. One of the things that looking down the road that I think Dinesen is well positioned for is to look at what's the impact of adding claims information to clinical data.
Yeah.
Then you have data that tells you what are the quality, what are the outcomes, what are the costs, what are the efficiencies, and the ability to then close the loop from provider to patient and back.
Yeah.
DHIN is really in a unique position to do that.
Yeah, the claims is a great point, Mike. And when you take like the financial information that's included in a claim from an insurance company, and then you marry it with the clinical information, and you can start to see what providers, what procedures are maybe the most costly, or maybe don't have the best outcomes. You can start to take action and also help organizations understand where they can be more efficient. And it's going to be a huge aspect of helping to bring down the cost of healthcare, which is got a laser beam focus right now. I mean, data tells a story, and then with the story you can take action. And I think that this is part of the exciting things that we're looking to offer here with this type of program.
That's great. So I mean, you talked about patients accessing the data and having it available to them and to their providers.
Yeah.
You talk about the notifications, which I think is a powerful thing that a lot
Yes.
of HIEs and other health information exchanges have done. What else is on the roadmap? Claims data sounds like is on the roadmap. Anything else that really
Yeah,
push
a
it forward?
couple things. Is one of the cool things that we did with our particular product was integrate a real-time alert system right to people's smartphones. So like you can get a text when a lab result has been delivered. Or if you're set up as a proxy for a loved one, let's say like in my case, my mom goes to the emergency room, I could get an alert right on my cell phone because of this platform telling me that mom's in the emergency room, all with her consent of course, or that an important test has been delivered either for me or for a loved one. So that right there is going to get me closer. The really cool thing about this is, what if I get that alert and I'm not in the emergency room? Somebody else is like using my data, using my insurance information. I can just tap on my cell phone and then send an alert right over to the insurance company and to the hospital saying, hey, something's not right here.
Yeah, and that goes to fraud and abuse, and even patient identification. Maybe it's the
Exactly.
wrong patient. It wasn't necessarily fraud. Could be either.
And that could be a patient safety issue.
Sure.
Yeah.
And to do some of those things, you start to get into really, I think, a wide open field that DHIN has in front of them, which is analytics. And what do you do when you have all of the data together? The basics that we're doing now are let's show that data to people, to providers and to patients in a way that they can process and understand and share. Next is, how do we help them extract information from that data? If you're a provider, can you look at population health type of data across the entire cohort? If you're a patient, can you get information on care quality and cost effectiveness and so forth?
Absolutely. Yeah, and not to get too wonky, because I know that that's not what people
we're
tune
wonky
into.
at HIMSS, come on.
But things like pre-authorizations, it can help delay the application of treatment, the approval of treatment. If we could take this information, combine it together, and kind of understand who the best in class is in terms of the providers, why should those people have to go for a pre-authorization every time for a particular procedure? And then you see where those folks are that are high cost, poor outcomes, they need help. Or maybe the insurance company adjusts like how they work with those providers, and like we could streamline that process with the best in class, help those folks that need help, or they kind of get out of that procedure, and then more efficiencies, more cost savings, and at the end of the day, it's about better care, and which is the ultimate outcome.
Sure. Well, that's great. I think pre-authorizations are the misery of every doctor I know. So let's finish off. Any final thoughts on what access to this health data means for patients and providers? I mean, it seems like you guys are doing it, and that's a lot of people can't say that, which is it's pretty impressive. But any final thoughts?
Well, yeah, I know it is in a nutshell. Part and part convenience, but also it's life-saving and transformative. We had a story told by one of our participating hospitals how a patient, a young child, had gone for a blood test, but it was not in one of their facilities. And then they were able to access their information on this child when they were going through like a routine checkup. And then we're able to see that the child had tested positive for leukemia. So instead of that not happening sooner, or instead of that child not receiving the care that they would have otherwise missed out on if that report had not been accessed, they're getting treatment and then their prospects for a healthier outcome are better than it would have been otherwise. So yeah, it's look, it ranges the spectrum of just making things more convenient to being life-saving. So it's a great space to be in.
Awesome.
Yeah, we think these are all things that you can do when you have, not just have the data, but you really address the interoperability, a big discussion and buzzword at HIMSS and meetings like this, and start to make it practical. Start to take that data, convert it into something that both providers and patients can understand. You really unlock a lot of capabilities for both of those populations.
Absolutely.
Yeah, and I see it as the platform for all future innovations. So
yeah.
That's great. Thanks so much. Thanks everyone for watching. We're here with Mike O'Neill, Chief Executive Officer of MedicaSoft, and Randy Farmer, Chief Operating Officer of DHIN, the Delaware Health Information Network. Thanks so much, and everyone watching live, check out more great health IT content at healthcarescene.com.